Today in this video, we are going to look at a case of soft cataract. We are going to go through the steps of cataract surgery. So here the side port incision has been made and we have injected some adrenaline and preservative-free xylocaine. Then we are staining the anterior lens capsule with the trypan blue dye and injecting some viscoelastic substance, which is a jelly-like substance which maintains the eye and makes it easy for us to do the cataract surgery. Now we are taking a bent 26 gauge needle, which is a very fine needle, technically called as a cystitome, to make the opening in the cataract. This opening is known as Capsulorhexis or continuous curvilinear Capsulorhexis. This is basically an opening in the topmost layer of the cataract, which is known as the anterior lens capsule. Here our aim is to make the opening continuous, round, circular and well centered on this light reflex that we can see. We can see the 3 dots and we can see excellent centration of this opening on these 3 dots, which gives a patient a very good vision. Now we are just doing a hydrodissection step, which is loosening up this cataractous material from the underlying capsule. Once we are sure that we have done this step well, we are injecting some more viscoelastic or the jelly-like substance which protects the cornea, and we are going ahead with our phaco probe. This phaco probe helps us in removing this cataract. So we are removing the loose cortex and the loose cortical material and the epinucleus that we see. And once we reach the core of the cataract, after removing this loose material, which is very important to take care of a soft cataract, once we reach the core of the nucleus, we are going ahead with what we call as creating a trench or sculpting. We just need to make a very shallow, narrow trench in this case because this is a very soft cataract. Then we keep the machine settings on very high vacuum and minimal amount of energy is given to just simply prolapse this nucleus out of this bag in which the nucleus is situated. Simply this machine we can see how easily can suck up all this cataractous material. So this is a very fast surgery, and once we have achieved this, now we just have to clean up this residual cortical material, which is the residual lens material very close to our capsule or the area in which we put the lens. So we are using an irrigation aspiration cannula with the 2 side ports and cleaning up this material. Now we are loading this single piece lens or IOL in the cartridge so that we can implant it inside the eye. So again we have put in a jelly-like substance or a viscoelastic in the eye as well as the cartridge, and we are doing a implantation of this single piece hydrophobic acrylic lens inside the capsular bag. We can see that the lens is very well centered. We are just making sure that these 2 haptics or the areas for support have loosened up and have taken up their place. Then we are clearing up all this jelly-like substance that we have used to implant the lens, making sure that the eyes is nice, clean and pristine and that the lens is very well centered. After we do this, we hydrate the ports to make sure we have a well sealed incision, and we can see we have a beautifully centered lens with a clear cornea at the end of the surgery.